Hi everybody, it's Miles Crosby once again with another PRTC Profiles, and today, well, we've got a special guest, Dr. Wikenheiser. Doc, good to see you, my friend.
Nice to meet you.
And I understand that your specialty is orthopedics?
Yes, it is.
All right, and we're once again conducting the interview here at Hampton Regional Medical Center, which is an affiliation of MUSC, and everybody knows about MUSC. But there's another medical facility that everyone knows about, and that's the Mayo Clinic.
Yes.
And I understand that you spent some time there at the Mayo Clinic.
I did. I trained at the Mayo Clinic in the late 90s, and I also worked for them for about 10 to 12 years.
All right, and orthopedics, now that covers a wide range. Give us a little bit about some of your specialties and what you like.
Our specialty is primarily the musculoskeletal system, so we'll work with fractures, joint replacements. We do degenerative processes like rotator cuff tears or compressive neuropathy, things like cubital tunnel or carpal tunnel, those kinds of things, sports injuries.
All right, well, somebody who's had 2 broken arms, I know how that can be a little bit. And
right.
my wife, she's a beautician, and all that repetition, she had to have carpal tunnel surgery as well. So I know a little bit about some of the stuff you do, and you know, we really appreciate that sort of expertise. Now, what made you decide on this particular area?
Most of my career I practiced in small rural hospitals just like this, and my daughter is a nurse anesthetist working for MUSC in Charleston, and my wife and I wanted to get closer to the region. Right. And we found this opportunity, and it was a perfect fit for me. All
right, well, fantastic. And of course, like I said, here in South Carolina, everybody knows about MUSC and the reputation they have. And you say your daughter works there down in Charleston?
Yes, she does.
All right, so obviously you want to be closer to her. And, you know, we've got the Hampton-Varnville area, and they have got such a fantastic facility here. When you came and first toured the area, what did you think about the Varnville Hospital?
I really liked it. It's, like I said before, it's a very nice rural hospital. I like the affiliation with MUSC, so we can transfer more complicated problems to them or more complicated reconstructive surgery. It's nice to have other experts in the area who can help us with the things that we can't do. But for a local facility in this area, we can do most of the orthopedics. For sure, the straightforward items, we can see patients and do the surgery here so they don't have to drive. And if we can't do it, we have a nice connection in Charleston or other MUSC facilities, sometimes Orangeburg or other places where they're available.
I tell you, it's wonderful that MUSC is tied in with rural hospitals, and you get just world-class care. You know, obviously you're a perfect example of that. Now, if somebody, let's say they had a broken arm, I mean, do they have to be referred, or can they come directly to the Hampton Hospital?
They can come right to the hospital. Lots of times when it's trauma like that, they'll go through the ER, and the ER will contact us and arrange for a follow-up appointment. If it's a critical thing that needs to be dealt with right away and we're around, we'll do that same day. Or they could be admitted to the hospital and we can take care of it the next day. If it's something that's requires more comprehensive care, then we would arrange for a transfer.
All right. Now let's say it's something that's going to be scheduled, like to say you need a knee replacement or you know, any sort of surgery like that. What's the process they would need if they would like to get you to do the work?
Normally they would be seen in the clinic, in the orthopedic clinic, and I'm there and my PA, Mallory Hunt, is there full-time basis. So one of us would see the patient, and then we would obtain x-rays and we try all the conservative measures first, including medications, injections, bracing, therapy. But if it looks like it needs to be replaced, we can do that here. If it requires a special kind of prosthesis, we would refer that. But most of the time, the patients we can do here. We get clearance from their medical doctor, and then we go ahead and schedule the procedure. They usually stay in the hospital. Sometimes you can go home the same day. Sometimes you stay for a day or two, and then we'll see them at follow-up.
All right, fantastic. Now, do you have the rehab facilities here as well?
We do, and that's another nice key for the local area. We can do rehab sometimes for joints. We'll do pre-joint replacement physical therapy to have the patients fitted for a walker, cane, discuss what the surgery is going to entail, and that way when they have the surgery, they're already set up in their home. If it's other things like rotator cuff surgery or hand surgery, our therapists could see the patients after surgery and help in the post-operative rehab.
Now, I've always heard, I've never had it, thank goodness, but I've always heard that rotary cuff surgery can be take a while to recover from that sort of thing.
It does. It can take a while. It's same-day surgery. We've got great anesthesia here that could do a nice block that lasts for a long time, a nerve block.
Right.
And we can do most of those procedures here as well.
I've also had friends that have had like hip replacements or knee replacements, and to a T, almost always they say, "Why didn't I do that sooner?"
Yes.
You know, when it starts really getting bad, and then they keep putting it off, and they said, "Wow, you know, really the recovery on those, I think now is getting pretty advanced." Correct?
Yes, it is. Most times people can go home lots of time, you know, within a day or two, lots of times day of surgery. It just kind of depends on how much help they have around and their medical condition. And then if they're really critically ill or need extra kinds of prosthesis or special revision kind of things, we can refer that. If it's not something that requires referral, we can have their primary doctor in the area see them, which is really nice to have their doctor see them before surgery, and then me and Mallory can go ahead.
Well, so you work hand in hand with their general practitioner, and then kind of get it going from there.
Yes, we do.
All right, excellent. Now, just a couple of other quick things I want to ask you about. Back injections. Let's say somebody has had you know, trouble with a ruptured disc or that sort of thing. Do you do that as well?
We don't do it at our facility. We can see the patients and do the imaging studies and then refer them if necessary. There is a spine clinic in town that we also have a good working relationship with, so we could generally get the patient seen quickly.
And you say imaging. You have the MRI machines here?
We do. We have MRI and CT scan as well as plain X-ray.
Okay, excellent, excellent. Dr. Wikenheiser, we're going to take a quick break. We're going to be right back. We're talking about orthopedics, and we're talking about everything that's available at the Hampton Regional Medical Center. Once again, they're an affiliate with MUSC. You're watching PRTC Profiles. We'll be right back. Hi, everybody. Welcome back to PRTC Profiles. We're talking to Dr. Wikenheiser, once again at Hampton Regional at the Medical Center, and it's affiliated with MUSC. And Doc, I understand that some of the surgery equipment and stuff is expanding here at the hospital. Tell us a little bit about that.
Yes, it is. We've been very fortunate in obtaining a grant that's allowed us to update a lot of the surgical equipment. That includes a new fracture table, a new shoulder table for our shoulder surgery, rotator cuff kind of procedures. We've had numerous other instruments that we were able to obtain and update. So we've really had a nice addition. We're going to be remodeling some of the lighting in the operating rooms, and we really had a nice facility to begin with, but it's really turning out to be kind of a massive upgrade that's making my job much easier and the outcomes for the patients better.
Once again, we've been talking to Dr. Wikenheiser, and we're talking about Hampton Regional Medical Center. If you have not seen the facilities here, it is phenomenal. It's a beautiful hospital. There are great, fantastic surgeons here, and it's well worth your time to come by and visit and see what they do have to offer. We're going to take a quick break, and we'll be back, and we'll be talking to another doctor here at the facility in just a few moments. Once again, you're watching PRTC's Profile. You know, it's doctors like you that when you come into this facility, I mean, the facility is wonderful, but then you see the talent that they have, and once again, he's a great orthopedic surgeon who, you know, worked at the Mayo Clinic, and now we have your expertise here in the Hampton, Varnville area is a huge boost to this area. And once again, it's affiliated with MUSC, so if you need to transfer somebody into the Charleston location, that is available as well, correct?
Yes, it is.
Hi, everybody. Once again, welcome to PRTC Profiles. And today we're once again at Hampton Regional Medical Center. We're talking to Dr. Charles Garner. He's the new general surgeon here at the hospital, and you're once again affiliated with MUSC. And when people think of MUSC, a lot of times they think of Charleston.
Yes.
And I understand you have a Charleston connection. Tell us a little bit about, you know, a little bit of history.
Yeah, I grew up in Charleston, and I went to high school. Fort Johnson High School that doesn't exist anymore, now James Island High School.
Right.
Of course, that's a no-no back in the day because Fort Johnson and James Island are big rivals.
Right.
But my mother is still living in James Island, so I go back there frequently. Yeah. I went to school at MUSC for medical school, and then I did my residency in Virginia.
Right.
And I was lonely for the coast. I did not like living inland. I grew up offshore fishing and fishing in general, so I wanted to get back to the coast. And I found out that there was a job opening in Georgetown, South Carolina.
Right.
And I went there in 1996 is when I started in private practice. And I was there till 2022.
Okay. And now you're in Hampton. And just out of curiosity, what made you decide to come down to this location?
Well, it's becoming harder to survive in private practice just due to the way medicine is nowadays. Right. And Hampton had a need for a general surgeon. I had a need to stay close to home for Mom.
Right.
And it was about equidistant. Hampton to James Island, as it was from Pawleys Island, where I lived, to James Island. And as soon as I interviewed here, I was like, yeah, this is the place for me.
Gotcha. I understand you also are a kindred spirit when it comes to hunting. You like to do a little hunting too?
Well, that's another reason why this was a good fit, because I can go hunting out my back door in my backyard, but
Nice.
we enjoy it.
Yeah.
And so my wife and I and my two sons moved down here. Then my daughter, she lives in North Carolina, but we've enjoyed it so far. So
Well, it's nice to have the family and in a country setting, and of course, Hampton and Hampton is just lucky to have you here as the general surgeon. Now, as a general surgeon for the hospital, tell us a little bit about what that entails.
Yeah, well, mainly general surgeons do a little bit of everything, and we do all types of intestinal surgery, and I have a special interest in bariatric surgery, but that gave me a good expertise, if you will, in gastric surgery, because that's what bariatric surgery is gastric reduction surgery. But we do all forms of gastric surgery, hiatal hernia repairs, all forms of colon resections for either diverticular disease and benign changes to colon cancer, all forms of abdominal wall reconstruction for hernias and inguinal hernias. I have a special interest in doing vascular surgery, but right now we can't offer that type of service here, but we offer just about every other service that I do.
And gallbladders and all that as well, right?
Oh yeah. So all gallbladder surgery. If there is a pancreatic problem and I don't operate on the pancreas every day, I would make an appropriate referral to someone who does operate on the pancreas every day.
I understand.
But for just about all other gastrointestinal things, that is stuff that I operate on the routine basis. And it's important for people in the community to know that we do that here. And they can stay here and have their colon cancer surgery. They can even stay here and get their colon cancer chemotherapy, all under one house. Dr. Ackman is our hematology oncology fellow, and he's right in the same office as I am, so it makes colon cancer follow-up and other things like that much easier because we're right there together. And a lot of times we see patients on the same day together, so we can bunch in their services and not have to spread them out over multiple office visits.
One of the things you said about making it easier too, one thing I love about this facility is, obviously I work a lot in downtown Charleston, and I love downtown Charleston, but
me too.
But also it can be difficult for a lot of, especially elderly people, when it comes to traffic and their families and all that, and they can come out here and get world-class surgeons in a convenient location.
And I think that I've received a lot of patients based on that alone. I love Charleston myself. I grew up there, but I don't have anything bad to say about any of the facilities there at all.
Of course.
MUSC is a great asset for this state to have.
Exactly.
And it's a great referral center, but not everybody has to be referred to a tertiary referral center.
Right.
We take care of colon cancer here. We take care of your gallbladder here, your hernia here. Hopefully, bariatric needs in the future, because I'd like to get back into doing that because it's a special interest of mine. You run into a lot of happy people in the office when they've lost 100 pounds and their other comorbidities are gone.
Exactly.
But anyway, I've been here for just over a year. Since I've come, they have replaced all of the laparoscopic equipment. So we got brand new laparoscopes and towers and things of that nature. And For the people who don't know about laparoscopic surgery, that's the minimally invasive surgery, and most operations are done that way now. So we have brand new equipment in that regard, and then they had Dr. Wikenheiser, who you just met earlier.
Right.
He's a new orthopedist. He came here shortly after me. So Hampton is working hard to provide facilities, provide physicians, and everything so that you can have your care done at home.
Oh, yeah, world-class physicians here in your backyard, basically.
And like I mentioned before, when I interviewed here, it was a no-brainer.
Right.
As soon as I met everyone, and from the office all the way to the OR, everyone was great, and it just felt right. So it was an easy decision for my wife and I.
Well, we're all glad you made that decision, and Dr. Garner, Charles Garner, we appreciate you.
Thanks for talking to me.
Thank you for talking to us.
Yeah. Well, I hope to do more hunting and fishing on my off time if I get any.
Well, after we get off camera, we'll talk more about that hunting and fishing. Hang tight.
All right.
Once again, we've been talking to Dr. Charles Garner. He's the general surgeon here, the new general surgeon at Hampton Regional. And once again, a beautiful facility and an affiliate of MUSC. Once again, thanks to Dr. Garner, and we appreciate you watching PRTC Profiles. Until next time, I'm Miles Crosby.